Hello and welcome. We are going to review the changes to Legacy Health Services medical benefits effective July 1st, 2019. Throughout this presentation, we will discuss plan options, the MedFlex network, preventative care, emergency room usage, disease management programs, price comparison tools, benefits of being a member, smart tips on how to be a better consumer, and a dependent audit. Effective July 1st, the standard plan option is being discontinued and you will have the following two options to choose from. Let's review the value plan first. The value plan has a single deductible of $3,000 and $6,000 for family. Once you meet that deductible, the plan pays 80%, you pay 20% until you reach the out-of-pocket maximum. For single, that is $6,600 and family, $13,200. You have the following copays under this plan: $35 for your primary care physician, $50 for your specialist, $35 for your urgent care, and then an emergency room copay of $250. The next plan option available is the MedFlex plan. This is a brand new offering and has no out-of-network coverage. The biggest difference between the value plan and the MedFlex plan is that it excludes the Cleveland Clinic as an in-network provider. This plan has a $5,000 single deductible, $10,000 for family. Once you meet the deductible, the plan pays 80%, you pay 20% until you reach the out-of-pocket maximum of $7,500 for single and $15,000 for family. You have the following copays under this plan: $35 for your primary care physician, $50 for your specialist, $35 for your urgent care, and then your emergency room copay is $250. All your preventative care services are covered at 100%, no cost to you, the member. This is regardless of which plan you choose and due to healthcare reform. Also, regardless of which plan you choose, non-emergency use of the emergency room will no longer be covered. It must be life or limb threatening to be considered an approved emergency room visit. Let's now discuss the MedFlex HMO network. It is an expansive network of hospitals and physicians that serve key metropolitan areas in the state. Please keep in mind that it excludes all Cleveland Clinic facilities. This health system offers clinically integrated networks with high-quality providers with strong service reputation. It has the same medical mutual customer care that you're used to today. Also, it offers the same award-winning service through Medical Mutual. Emergency services rendered out of network are covered for emergencies only. No emergency room coverage for non-medical emergencies. There's no gatekeeper required for specialist care. The subscriber must choose your primary care physician. You have access to the nurse line in lieu of the telemedicine feature. You do have access to notable children's facilities, and prescription drugs include an enhanced pharmacy network, a national preferred plus formulary, mandatory mail order, coverage management programs such as prior authorization, step therapy, quantity limits, and the Specialty Solutions Program. This is a visual of the MedFlex network service areas. As you will see, the dark green counties are the primary service areas. Each county does have a participating health system in its primary service area. To locate a SuperMed or MedFlex provider, visit medmutual.com and follow the prompts. When you get to the network drop-down section, be sure to select either SuperMed PPO for the value plan or the MedFlex for the new HMO plan. There are some changes to the prescription benefit effective July 1st, 2019. All copays remain the same as they are today. However, the mandatory mail order for any maintenance medication is required after the second refill. If you do not utilize mail order for your maintenance medications after the second refill, the cost will double if you choose to continue to fill at a retail pharmacy. Another change pertains to the pharmacy network. Effective July 1st, 2019, CVS is an excluded pharmacy. This slide shows the pharmacies that you can utilize. Please remember the plan will exclude CVS as a participating pharmacy effective July 1st, 2019. This is not an inclusive listing of the participating pharmacies. For that full listing, please visit medmutual.com. Another change is the addition of the SaveonSP, a copay offset savings program. The program will identify members on a specialty drug that applies to the program and reach out directly to them. If you become eligible at a later date for the program, you will receive an outreach call from Medical Mutual. This program is beneficial to you, the member, as it reduces your responsibility to zero for certain specialty drugs. Through Medical Mutual's MyCareCompare tool, you will see what locations are at or below coverage maximums. During your search, you will see the green locations are the facilities that are at or below coverage maximums. Red locations are above the coverage maximums. You will pay more if you utilize a red location. Legacy would like you to be healthy. Preventative care services are covered at 100%, no charge to you, the member, regardless of the plan you choose. Preventative care utilization is low. Please take advantage of this free service. It keeps you healthy and can prevent something minor turn into something major. Here are some statistics of the underutilization of the preventative care services. 66% of women greater or equal to 49 have not had a mammogram in the past 12 months. 87% of members greater or equal to 50 have not had a colorectal screening in the past 24 months. 86% of women greater than 20 have not had a pap smear in the last 2 months. 76% of men greater than the age of 50 have not had their PSA levels checked in the past 2 years. Top 5 reasons to get your regular preventative care. It's free. All of your age and gender appropriate preventative care is covered with no cost to you under the medical plan. You can prevent health problems. You should be building a relationship with your doctor. The more comfortable you are with your doctor, the more likely you are to see him or her when you don't feel right. Establish baselines, up-to-date vaccinations, and review and renew your prescriptions. Remember, it's free, so take advantage every year. Effective July 1st, 2019, non-emergency use of the emergency room will no longer be covered. Legacy would like you to get the most value for your money. In calendar year 2018, there were 117 medical plan members that used the emergency room for non-emergency use. Please consider the most appropriate place for care before receiving services. There are alternatives to the emergency room. How can you help control healthcare costs? Please avoid using the emergency room for non-life-threatening conditions. Effective July 1st, 2019, non-emergency use of the emergency room will no longer be covered. Visiting the emergency room should be reserved for life or limb-threatening health concerns. Some examples would be severe chest pain, severe break or compound bone fracture, excessive or uncontrolled pain, difficulty breathing, head injury, or accidents requiring immediate medical intervention. Urgent care is a great alternative to the emergency room. If your primary care physician is unavailable or it is outside their normal business hours, urgent care centers are available to provide the quick medical attention for those non-life-threatening conditions. Those are things like sprains, minor burns, minor broken bones, stitches, and illness that require immediate care. Please remember to utilize urgent care in lieu of your emergency room for non-life-threatening conditions. Legacy would like you to be healthy. Proper care of chronic condition improves longevity and quality of life. We want to share a few statistics with you. 35% of our members with asthma have not had the appropriate medication in the past 12 months. 59% of members with cardiovascular disease have not had a lipid panel profile in the last 12 months. 83% of members with diabetes have not had a retinal eye exam in the last 12 months. 54% of members with diabetes have not had their semi-annual HbA1c test in the last 24 months. 64% of our members with high cholesterol have not had a laboratory test in the last 12 months. Medical Mutual does have a disease management program that offers support for these chronic conditions. If you have one of these chronic conditions listed, you are eligible to participate in the disease management program. Through this program, you will work with experienced clinical staff that will assist you to better manage your condition through education, empowerment, and support. If you are contacted, please participate. Benefits of being a member. MyCareCompare. MyCareCompare is an online transparency tool that you can find on Medical Mutual's website. This promotes member price awareness to become a better consumer of your health care. It offers you cost estimates, quality ratings, and cost comparisons. As we've mentioned, facilities charge different amounts for the same services, so always be a good consumer and use your MyCareCompare tool on Medical Mutual's website. One of the most valuable tools on My Health Plan is the MyCareCompare resource. Here, you can search for the cost of various medical procedures. The costs range based on where you receive treatment. In most cases, standalone facilities will be less costly than services received in a hospital setting. This slide gives you an idea of the wide range of costs for a knee surgery. This is just an example. The cost for this service ranges from $3,200 at a freestanding surgery center to over $11,000 at a main hospital. It is wise to use these tools and know before you go. Medical Mutual uses Express Scripts for mail order. Online ordering is simple and done through Medical Mutual's member website, medmutual.com. From the drop-down box, click Prescription Drug Benefit and we'll reroute you to Express Scripts website. It is a single sign-on process, so you do not need a different username or password for the Express Scripts website. When you have health questions, get the help you need and put your mind at ease by utilizing the nurse line. The nurse line has highly trained and experienced nurses that take your calls. They also offer health counseling, education, and help with symptom identification. They also help determine if the emergency room is the right place of care. The Superwell Quit line can assist users kick the habit. Take advantage of this resource if you need help, and you can get up to 8 weeks of free over-the-counter nicotine replacement therapy. Quitting can be difficult, but no, Medical Mutual is here to help. My Health Plan is a secure website specifically for Medical Mutual members. It makes it easy and convenient to manage your plan. It offers a personalized dashboard that shows the status of any claim and can track any expense, deductible, and co-insurance. You can review an explanation of benefits and even find a network provider. You will also find information on a variety of topics that we discussed today. Creating an account is simple. Visit medmutual.com, click register, and follow the simple instructions. You will need your ID card. Did you know Medical Mutual has a mobile app? Medical Mutual's mobile app provides handheld access to claims, provider search, expense tracking, and provides an electronic ID card. It can be downloaded via your app store. The next 4 slides offer smart tips on becoming a better consumer. If you follow these tips, you will see savings with your healthcare dollar and help reduce the cost to your employer's plan. Smart tip number 1. Did you know you can save money by shopping around for diagnostic medical testing? Fees for these services vary tremendously by facility. The next time your doctor recommends an X-ray, CT scan, MRI, or any other type of diagnostic testing, ask questions and shop around. Medical Mutual has a cost comparison tool to help guide you. You can inquire about cost savings alternatives. Being a healthcare consumer can be tricky. With a variety of places to go for care, it is sometimes confusing to know which option is best. When you are experiencing a medical emergency, you should proceed to the nearest emergency room. When you are not experiencing an emergency, you have several options. You have your retail health clinics, your doctor's office, urgent care, and your telemedicine. When you cannot see your doctor during the day, see if a retail health clinic is an option. Always try to avoid the emergency room for non-emergency situations. Review your options before you need them. This way you will know your options when you need them and can quickly decide the best place to go for care. Smart tip number 3. We all know prescription drugs can be expensive. By being a smart consumer, you can take control of the cost and save money. Start by talking to your provider. Don't be afraid to ask questions about alternatives to the prescription you are currently taking. Generics are available and do cost less. Take the current drug listing with you to your next appointment and discuss options with your provider. Pharmacy shop. Did you know different pharmacies charge different amounts for the same prescription? Compare your costs on Medical Mutual's website. And of course, utilize mail order after your second refill for your maintenance medication. If you do not utilize mail order for your maintenance medication after the second refill, you will pay double. Another tip is to look for coupons. GoodRx is a great website where you can shop for coupons for your prescriptions. Smart tip number 4. Make sure you use in-network doctors and hospitals. Remember, you can look for a listing of in-network providers and hospitals on Medical Mutual's website. And make sure you prepare for your office visit. Make sure your doctor is in-network. Make a list of all your questions and any health changes to discuss with your doctor during that visit. And always remember to bring your member ID card with you. And lastly, smart tip number 5. Take advantage of your preventative services. They are covered at 100% no charge to you. Just please be aware of the difference between preventative care and diagnostic care. Your insurance coverage may be different depending on which type of service you receive. Many preventative services are covered at 100% at no out-of-pocket cost to you. Be sure to ask your doctor why a test or service is ordered. The same test or service can be preventative, diagnostic, or routine chronic care, depending on why it's done. And the cost of the service may change based on how it is defined and coded. Coming soon is a dependent verification audit. What is a dependent eligibility audit? A dependent audit is a tool that provides employers like Legacy a means to manage healthcare costs for its employees. The audit validates the eligibility of its employees' claim dependents. Why is Legacy implementing this audit? Legacy is conducting the audit for 2 reasons. First, Legacy is committed to providing its employees and their dependents the best possible healthcare plan at the most affordable price. To do so, Legacy is examining their healthcare plan and processes to identify any insufficiencies or waste. Second, the enrollment of ineligible dependents increased healthcare costs for both Legacy and you. Do you need to do anything now? No. You will receive an employee eligibility verification packet in the mail. Please be on the lookout. The packet clearly spells out what you must do to be compliant with the audit and continue to receive coverage for your claim dependents. How does the audit work? Within the next few weeks, you will receive a dependent eligibility verification packet at your home address. The packet will arrive in a large white envelope with the Legacy logo. Included in that envelope will be several items, including a pre-populated form that lists your currently enrolled dependents, a 4-step checklist that will walk you through the audit process, including the definition of eligibility for each dependent, the documents you must submit to validate each claim dependent, where you can acquire those documents if you don't have them on hand, and then how to use the pre-addressed postage paid envelope included to submit your documents. An email helpline will be available that you can use 24/7 to ask questions about this audit. The documentation you will need to provide are typical documents required, such as marriage license, birth certificates, divorce decree, adoption papers, and your 2018 IRS 1040 cover sheet. Your kit will identify the exact documents required and where to get them. All documentation will be destroyed upon the completion of this audit. Here are some examples of what you have to do. Let's assume you are claiming a spouse and a child. You receive and open your personalized audit packet. Confirm the accuracy of your claim dependents data listed on the workbook. Gather your marriage license, your child's birth certificate, and the cover sheet from your 2018 IRS 1040. You then place those documents and your workbook in the provided pre-addressed postage paid envelope and drop it in the mail. That's it. It's that simple. If you don't comply, that will result in the deletion of your healthcare coverage for your claim dependents.